Let's proceed on to longitudinal portal vein view, which is between shoulder and navel in its axis. Please show us the position of the probe. Thank you. Again, we place the transducer below the costal arch, between shoulder and navel, and we can see.
I prefer another maneuver. I first take the subcostal view and then turn the transducer 90 degrees anti-clockwise.
Ah, okay. So that's your approach.
It's the same view.
It's the same view, just another way to approach it.
Now we see portal vein on its way into the liver, and over there, common bile duct can be seen.
On its way out of the liver.
Portal vein is going into the liver.
No, the common bile duct is going out of the liver. Another picture. This is a video clip. Okay, you're right.
So we have also the gallbladder in the view here, and
portal
vein in the dorsal part of the picture, and superior common bile duct, which is...
It's not so easy to see in this picture.
Yes.
I would take some color Doppler to identify it, and we will show this to you in our intercostal view.
We have already seen branches of the portal vein and some bile ducts intrahepatic, but to detect the whole portal vein, we need another view. Can you show us?
Yes, I'd like to. I place my transducer under the right costal arch, in a right angle to the ribs. Ask my patient to inhale.
So there you got it.
Oh yes, nicely to see.
Portal vein over here. And what's this small tubular structure?
This should be the common bile duct.
Correct, the common bile duct. It should not exceed 6 millimeters in diameter. I can measure it.
When the gallbladder is present?
Only 3.9 millimeters. So
this is normal. When the gallbladder has been operated, the bile duct can be up to 10 millimeters, and this is still normal.
But in this case, we can see the gallbladders over here. So there was no operation before.
And this structure over here, just to tell?
It's the IVC.
This is another view we have to document in our report. So now we've got one last view for you. It's
the intercostal view. So we place the transducer in between the ribs on the lateral thorax.
In the intercostal space.
And get this view. So we can see liver parenchyma, the IVC, portal vein, and in this view also the gallbladder.
And I think we can see the bile duct over here. Common bile duct.
Correct. So that's the best view.
But that's a video.
Everything in one view.
That's a video.
Okay.
Thank you. So it's even
perfect.
Even
Portal
more
vein,
beautiful. Mm-hmm.
Bile duct.
And the gallbladder over here.
Gallbladder, yes. And with color Doppler we can identify the portal vein so that we don't mix it up with the common bile duct. Very fine.
Just another picture where we can see the IVC in bluish over here and the portal vein from an intercostal view.
There are some situations when we don't have good examination conditions, especially in case of emergency. And we are asked, are there gallstones? Is there a biliary obstruction? And how does the liver tissue look like? So we have got another scan for this question.
I can perform an intercostal scan. I place my transducer into the space between the ribs, in the intercostal space. And there I can get a view of the liver tissue itself. And I can also tilt my probe in this position.
Perfect. You got the gallbladder over here.
At least a glimpse of it.
There's no stone in the gallbladder.
I can tilt my transducer even more. And I can also change the intercostal space. And you see, when I go up one intercostal space, the gallbladder is even easier seen over here.
And over there, you find the common bile duct. It's not dilated, so there's no biliary obstruction. So we could answer all these questions.
So we can say this is our emergency scan for the liver. Let's recapitulate the most important measurements of the liver. We got the portal vein, which should be under 12 millimeters. The hepatic veins, which should be under 6 millimeters in the periphery. The common bile duct, which could be up to 6 millimeters when the gallbladder is still in situ, and up to 10 millimeters after cholecystectomy. Do you remember the liver segments in our chapter of liver's anatomy? We want to take a look at them again, but this time in ultrasound pictures. Let's get started.
Here we've got a lovely picture of the liver and the liver veins. The middle one, the right one, and the left one.
This is a transverse plane, a subcostal view of the liver. We remember our main orientation guide for the liver segments are the hepatic veins.
We can see the middle one. It divides the left lobe from the right lobe over here. And we can additionally see the right liver vein and the left liver vein over here.
So now we can count the segments of the left liver lobe first. We got segment 2 and 3, segment 4A and B, and additionally segment 1, which is quite near the IVC. And the segments 2 and 3 are situated left of the left liver vein.
So near to the heart over here.
The heart over here. Segment 4, 4A and B, is situated between the middle and the left hepatic vein. And segment 1 is situated adjacent to the IVC.
But we can't see it in this picture.
Because it's more caudally.
The right liver lobe contains the liver segments 5, 6, 7, and 8. So we can see liver segment 6 and 7 in this part. And in between the middle and the right liver vein, we can find liver segment 5 and liver segment 8. We proceed with the longitudinal scan.
So we start with the longitudinal epigastric view and have the left segment of the left liver lobe over here to the far left side. This is segment 2, which is cranial, and segment 3, which is more caudally. So let's get on to the next picture.
And we see more cranial liver segment 4A and caudally, near to the caudal border of the liver, segment 4B in this region.
And we get this picture when we move more to the right side of the patient. So let's take a sweep even more to the right side.
And additional to segment 4A and 4B, we now can see segment 1 near the IVC in this region. Even better.
This is a beautiful picture, yes, segment 1 and the IVC is an adjacent structure. So let's get even more to the right side. We'll take a sweep more to the right side of the patient.
So now we are concerned with the right liver lobe, and cranial we find liver segment 8 and caudally liver segment 5 over here.
So now let's get on even more to the right side, to the far right side of the patient, the two segments that form the right border of the liver. These are?
Liver segment 6 and 7. 6 is caudally and near to the kidney, to the right kidney, and 7 is near to the diaphragm over here.
So the right kidney is also a good orientation guide for finding the liver segments, because segment 6 is situated adjacent to the right kidney and segment 7 is cranial.
Correct. Now for concluding the liver segments, let's view the transverse plane again. Now we're looking for the cranial segments, so we can see on the left side, the left liver lobe, segment 2, on the very near to the heart, on the left side. Segment 4, it's 4A in this region.
Between the left and the middle liver vein.
And on the right side, in the right liver lobe, we find liver segment 8 over here, and the mostly right segment On the right side is segment 7 in this area.
So segment 7 is the most cranial segment, which is on the far right side of the patient.
We sweep the transducer caudally and can identify the caudal liver segments. On the left liver lobe, we will find segment 3 and segment 4B. The left liver lobe.
And also our segment 1, adjacent to the IVC.
In this region. Fine. On the right side, there are liver segment 5 and 6.
So our main orientation guides for the liver segments are the hepatic veins, the portal vein, and the right kidney. We start with the longitudinal epigastric view. Place the transducer in the midline in the epigastric area. Adjust our picture and can easily display the left liver lobe over here.
So we can see branches of the portal vein and over here liver veins, diaphragm.
Something moving over here.
The heart.
So we ask our patient to inhale, please. Now I tilt my transducer to the left side of the patient. Get a picture of the left liver lobe.
Perfect.
And I perform this movement again, a little bit more caudally, so that I can have the caudal rim in my view also. Over here. And back to the midline again. Breathe normally, thank you.
So we scanned the left liver lobe in the longitudinal scan.
Next, we proceed to the longitudinal subcostal view. We ask the patient to turn into a left lateral position. Again, I place my probe in the epigastric area in a longitudinal position. And now I move my transducer to the right side of the patient along the costal arch.
You can nicely see the aorta over here, the heart beating here.
Left liver lobe. And now please inhale.
Over here, the liver vein and branches of the portal vein over here, with bright echoes in the wall.
Keep my focus on the cranial parts of the liver now.
You can see the diaphragm over here.
Until the very right rim. Exhale.
Perfect.
And inhale again, please. And now I go all the way back.
So we focus on the caudal border of the liver and scan the parenchyma of the liver.
Kidney over here. Back to the midline. Exhale and inhale, please.
So, and now back to the midline again.
Vena cava over here.
The renal right artery here. Portal vein. And back to the midline.
We proceed to the transverse view of the left liver lobe. Place my transducer in the epigastric area in a transverse position. Turn it a little bit to adjust to the left costal arch. Ask my patient to inhale. And tilt my transducer upwards so I can see the left liver lobe in the transverse position.
The left liver vein over here. IVC.
Now I go back to the midline, exhale and inhale again. And proceed to the subcostal transverse view.
So we have seen the heart over here, liver parenchyma, IVC, right, middle, and left liver vein very nicely over here.
Exhale and inhale, please.
There are normal findings in the liver parenchyma.
Now tip my transducer more caudally.
So we see branches of the portal vein, hepatic artery. Once again, IVC.
And to the caudal rim of the liver. And again, a little bit more laterally, so that I get the lateral parts of the liver in my view too. Again, inhale, please. Tip my transducer upwards and slowly downwards. And keep also the right parts of the liver in my view.
So we also see the uppermost regions of the liver. Segments 7, 8, 6 and 5.
And downwards.
Right kidney over here. IVC.
For the longitudinal portal vein view, I place the transducer below the costal arch in an oblique position. We can easily display
Portal vein over here. IVC is inferior to the portal vein. In this region we can detect the hepatic artery and the common bile duct as a tubular structure. Very nice. Over here is the aorta.
Maybe we could show the
Spinal
portal vein and the common bile duct in a nearer field.
So we zoom to this ligament, this portal vein, common bile duct and hepatic artery in this region.
Beautifully displayed.
We can add color Doppler and we can see flow in portal vein, the hepatic artery, and no flow in the common bile duct.